Hello, and welcome to the debriefing broadcast for the 2013-2014 Continuum of Care Application and 2013 Project Applications. My name is Ann Oliva. I'm the Director of the Office of Special Needs Assistance Programs, also known as SNAPS. For this debriefing, the SNAPS office has worked hard to provide more detailed information than we have in the past. That means the presentation is a little bit long, but I encourage you to watch it in its entirety because it has information that's critical to improving the quality of the project applications for 2014 and beyond, and the Continuum of Care application for 2015 and beyond. So let's get started. Today's broadcast will cover 8 general topics. First, we'll provide a general overview of the 2013-2014 Continuum of Care Program Competition. Then we'll go over funding highlights related to the 2013 awards. We will also go over how Continuum of Care need is determined, as well as discuss reallocation and how that worked out in this competition. Next, we'll move on to a detailed discussion of the Continuum of Care application and scores, followed by information on the 2013 project applications. Once we've wrapped up all of the information for the FY2013 portion of the competition, we'll discuss the FY2014 GIW and modified Continuum of Care registration process. The last slide in our presentation today will provide a list of resources for continuums and project applicants. So first, I'm going to give a brief overview of the 2013-2014 Continuum of Care Program Competition. When we talk about the Continuum of Care competition during this broadcast, unless we say differently, we are referring to the 2013-2014 Continuum of Care Program Competition, which was the first time ever that we did a 2-year notice of funding availability. I think it's important for communities to know why we did a 2-year NOFA. And really, we did this to help us get back on track in terms of a timeline and a schedule so that we can have the 2015 competition much earlier in the year and folks can go back to having holidays at the end of the year. We also wanted to provide some relief to our continuums across the country in terms of the Continuum of Care application itself, which takes a lot of energy and effort. I know I used to actually help write one out there in the field. And we didn't want to have you do 2 Continuum of Care applications in 1 calendar year. So that's really why we did a 2-year NOFA. The competition opened on November 22nd and closed on February 3rd, 2014. We announced 7,094 Tier 1 renewal projects on April 8th at about $1.56 billion. On June 19th, HUD announced the remaining awards for the FY2013 portion of the competition, which were new projects in Tier 1 and renewal and new projects in Tier 2. We awarded 898 projects at about $141 million. That included 436 new permanent supportive housing or rapid rehousing projects. There was no minimum score associated with the Continuum of Care application this year. The Continuum of Care NOFA had several key changes in the 2013-2014 round. First, as I mentioned, this NOFA and all of its requirements applied to 2 years of funding, both 2013 and 2014. That means that the Continuum of Care score received on the CoC application applied to both years, or applies to both years. So there will not be a new application for the 2014 round of funding. We also knew going into the 2013 portion of the competition that the $1.7 billion that we had available through our appropriation was less than the annual renewal demand amount for the country, which meant that there was not going to be enough funding for all renewals. And while we thought that this was a possibility back in the 2012 round of funding, the funding situation in 2013, due to inadequate base funding and sequestration layered on top of that, really made the FY 2013 picture much more difficult. HUD also included new policy priorities in the NOFA and highlighted key policy areas for both 2013 and 2014. And we really were trying to help continuums make more strategic decisions, especially when you're talking about a year where there's potential cuts coming down the road. We wanted our communities to be as strategic as possible, and the policy priorities were designed to help you all make those decisions. The other key distinction that I'll talk about in a moment in this competition versus other years was the new selection order that we used, or the order in which projects were picked for the competition. In years past, HUD awarded projects by Continuum of Care, renewal projects by Continuum of Care score. In other words, renewals were all sort of awarded as a group. So the highest scoring continuum would get all of their renewals, and then the next highest scoring continuum would get all of their renewals. But because we were in a cut situation, what we wanted to do was break out renewals and ensure that we could prioritize the types of renewals that are most important to all of us. And I think that everybody would agree that those are the projects that actually provide housing. We wanted to safeguard as much as we can the types of projects that actually are housing people who are formerly homeless or are experiencing homelessness. As I mentioned, the Continuum of Care NOFA included 7 policy priorities. In advance of the NOFA, for about 12 weeks, we published a series of messages that came from my desk, signed by me, called the SNAPS Weekly Focus. And these policy priorities were discussed in some detail, and we took some time to really try and explain why those priorities were important to us at the federal level and how they could really impact the decisions that communities were making at the local level. The policy priorities themselves are in line with HUD's strategic plan and with Opening Doors, the federal strategic plan to prevent and end homelessness. Continuums were evaluated in part based on the extent to which they were implementing the policy priorities that were listed in the NOFA. So let's briefly take a look at those, because you're going to see these as a theme as you go through the presentation today, because they will come up in the discussion around scoring. The first overarching policy priority is really strategic resource allocation. What we really wanted communities to do was take a hard look at their projects, and projects that were maybe underperforming, obsolete, ineffective, maybe not using the best models or the most effective models, could have been reallocated to projects that were really evidence-based and maybe more towards permanent supportive housing or rapid rehousing, which are proven or promising models. Our next policy priority was ending chronic homelessness. Obviously, we have a goal to end chronic homelessness in 2015, and continuums were scored on the extent to which they increased permanent supportive housing for people experiencing chronic homelessness, and the extent to which, and this was the first time we've ever scored on this, they use a housing-first approach in their permanent supportive housing. They could also reallocate projects to permanent supportive housing projects for 100% chronically homeless. And they could also, we also asked our communities to take a hard look at their non-dedicated permanent supportive housing stock and work towards prioritizing people who experience chronic homelessness into those permanent supportive housing beds. Ending family homelessness is our next policy priority. And you saw this in a number of ways. The first and most important was the other type of project that could be created through reallocation was rapid rehousing, specifically for families. We also asked folks to look at barriers that exist in their programs, a lot of which really impact families, and to remove those barriers to the continuum of care resources so that access could be opened up in a broader way to families who really need to access our resources. We also ask communities to maximize the use of mainstream resources. You all have seen us say this for probably 15 years, but this year we focused a little bit more on the Affordable Care Act and how communities could link to the resources made available through the Affordable Care Act to help fund different kinds of services for people who are being served in our programs. Building partnerships has also been a theme for the last number of years, but we also asked very specifically for our communities to look at two types of partnerships. One, with their local public housing authorities, and two, with philanthropic organizations within their network to help bring additional affordable housing and other resources to the continuum of care. And then the seventh one, last but not least for sure, are our other priority populations. The first one is veterans, and we asked communities to think about how continuum of care resources could be used for veterans who are not eligible for VA medical services and therefore not eligible for programs like HUD-VASH. And we set the baseline on youth, on homeless youth. We asked some questions to try and understand what communities are doing well and what needs to be improved on youth homelessness so that we can take those practices and implement them in the coming years. So in addition to the new homeless policy priorities, HUD also changed the way that we selected projects from the way that we've done it in the past. In a year where we knew that it would be likely that we would have to cut projects, we wanted to be sure that we were protecting the projects that provide housing, first and foremost, especially permanent housing. We did this within each tier so that communities still had the flexibility to protect the kind of local projects, even if they weren't housing projects, by placing them in Tier 1. So for example, if a community wanted to really protect their homeless management information system project, they could have placed it in Tier 1 and it would have been protected. The order of selection in the NOFA prioritized those projects, again, that HUD really thought were most important and in line with our policy priorities. Unlike in the past, HUD awarded all of our renewals first and then all of the new projects, regardless of project type. In FY2013, selection was based on component type. This allowed HUD to ensure that permanent housing, both new and renewal, were preserved. It also allowed HUD to fund more projects of a particular type across continuums rather than funding one continuum of care in total before moving to the next highest scoring continuum. So I want to do a brief overview of the selection, the order of selection. Here's some additional detail. We prioritize project types, which you can see on the slide and you can read in the NOFA. We looked at the first category. Let's say it was renewal, permanent housing, which was both permanent supportive housing and rapid rehousing. And we funded the highest scoring continuum and then the next highest scoring continuum until we had funded all of those renewal permanent housing projects within the first tier. If a CoC had more than one project in that category, then we would use the order established by the continuum to fund them in order. Then we would fund the next highest scoring continuum all the way through the lowest scoring continuum until we had funded all eligible renewal permanent housing projects in this particular example. Then we would go to the next category, which is new reallocated permanent supportive housing for people experiencing chronic homelessness, and we would do the same thing. Go from the highest scoring to the lowest scoring by the order in which you submitted those. So we did that within Tier 1 and within Tier 2. We used the same order. I want to make a note here because I think that there was some confusion about the review of projects, especially new projects created through reallocation. And I think it's important for all continuums and their applicants, their project applicants, to understand that just because a project was placed in Tier 1 or that is placed in Tier 1 in any subsequent competition, that does not mean that it will necessarily be funded, because every project, especially new projects, are subject to the threshold and eligibility criteria as outlined in Section 5E of the NOFA. So if your community had a project in Tier 1, a new project created through reallocation, let's say, that was not funded, the likelihood is that it was not funded because it didn't meet the threshold or eligibility criteria as outlined in Section 5E of the NOFA. So I would take a look at those. We also sent out letters in the last week to communities that cited the reasons for any denied funding so that our project applicants could really understand, even if they were placed in Tier 1, what happened and not make those same mistakes again in the future. This map represents the areas that are covered by continuums of care across the country. So you know that when you go into registration, you claim a geographic area. In 2013, you claimed geographic areas for both the 2013 and 2014 rounds of funding. And you can see here that most of the country, the vast majority of the country, is claimed by continuums of care. Except we have some areas in California, it looks like Arkansas, a little bit up in New York, and then some pockets around the country that I would suggest for the 2015 competition that every continuum of care refer back to this map in case you are not claiming a geography that you really are entitled to. I want to turn my attention just for a moment to Unified Funding Agency designations. In the 2013 registration process, we had 17 collaborative applicants that requested UFA designation. 2 collaborative applicants were actually designated as UFAs. That's California 606, which is Long Beach, California, and Ohio 503, which is Columbus, Ohio. The review for UFA is a 2-part review. First, a threshold review is completed to ensure that all the questions are answered in their entirety and that the application itself is complete. And after that threshold review, then we take a look at the answers in depth, and a panel actually reviews them together to ensure that anybody who is designated as a unified funding agency actually can meet the criteria of a UFA as laid out in the interim rule at the citation that's on the screen. Any collaborative applicant that is requesting UFA designation must have already been performing the duties outlined in the rule. So it's not really prospective to the extent that the continuum of care has to be strong, it has to be in place. The collaborative applicant has to have a clean audit. Those are the kinds of things that have to actually be in place. It can't be prospective. HUD's review included information provided by the collaborative applicant based on, again, what that collaborative applicant is already doing, not what they think they're going to do in the future. And just a reminder that UFA designation is annual, and that means that any continuums that are designated as a UFA in 1 year will have to reapply in the following year. And before we move on, and I turn this over to the SNAPS staff to walk you through the continuum of care and project applications, I wanted to touch just briefly on the topic of the applicant profile, because this actually causes us a number of problems each year, and we're hoping to cut down on this because it actually, when we have to do callbacks on applicant profiles, it actually delays our ability to get the awards announced in as timely a manner as we would like. It's important to remember that an applicant profile must be completed for both the continuum of care and project application, even where the applicant is the same entity. And this is, I think, the biggest area of confusion. The continuum of care applicant profile is designed to capture information on 3 different types of entities. 1, the CoC designated collaborative applicant. 2, the CoC designated lead for homeless management information systems. And then lastly, what we call the resource person on homelessness. And this is really to help us make sure that when we have somebody who calls us, and we get a lot of calls in the SNAPS office from people who are seeking services within their community, that we really can refer them to the right place within the community instead of sort of blindly giving them a phone number to try at the local level. All of the information that is in the CoC applicant profile must be reviewed and updated at least annually during the continuum of care registration process to reflect the current responsible organization for each of those areas and people. This information carries over to the continuum of care competition and then is reviewed by us for consistency. The collaborative applicant name listed in the CoC applicant profile must match the name listed on both the grant inventory worksheet and the Continuum of Care application. If not, we have to do a callback. Also, the HMIS lead identified in the CoC applicant profile must match the name of the project applicant for the CoC's dedicated HMIS project, because there can be only one HMIS lead designated for every continuum of care. The project applicant profile, on the other hand, is intended only for applicants submitting a project application in eSNAPS and really must accurately reflect the name of the project applicant that is applying for funds and include all of the required attachments. Again, when we don't get the required attachments, those are all legal requirements that have to be fulfilled in order for us to make awards. That means that we have to do callbacks, and that delays our ability to get awards done. In most cases, the collaborative applicant itself will also have a separate project applicant profile, at least for continuum of care planning or UFA costs, and any other projects that the applicant is applying for. So I want to thank you again for your time and attention. I hope you get a lot out of today's presentation, and I'm going to now turn it over to my staff to walk you through the details.
Thank you, Ann. Now that we've done an overview of the competition, I'm now going to present some funding highlights related to the award of the FY2013 funds. There were 8,377 project applications submitted into eSNAPS, all of which were reviewed by HUD staff. These project applications requested a total of more than $1.725 billion, which was more than HUD had available. HUD awarded $1.7 billion to nearly 8,000 projects. The selection criteria discussed earlier dictated the order HUD used to select projects. HUD was able to fund all eligible new permanent housing projects requested in Tier 1 and Tier 2, as well as permanent housing and transitional housing renewal projects requested in Tier 2. Unfortunately, more than 300 otherwise eligible HMIS, supportive services only, planning, and UFA project applications that were ranked in Tier 2 were not awarded funds. This represented over $23 million in total requests. We understand that some CoCs with projects that did not get renewed may wish to request technical assistance. You can make a request for technical assistance by visiting onecpd.info. Make sure you provide a detailed description of what your technical assistance needs are. Based on the information you provide, HUD will determine the type and the level of assistance available to you. If you are a subrecipient organization, meaning you do not receive funds directly from HUD, but receive them through a competitive HUD recipient, please contact the recipient so they can submit a request for technical assistance on your behalf. This map shows each geographic area and whether it is located in a CoC that is in annual renewal demand or preliminary pro rata need status. The orange areas are in ARD. The green areas are preliminary pro rata need status. No shading indicates areas that are not claimed under a CoC's geographic area. As you can see, most areas in the country are in CoCs that are in ARD status, meaning that the sum of 1 year funding for all of their renewals is greater than the CoC's preliminary pro rata need amount. In FY2013, HUD awarded 7,374 renewal projects, which is about 200 less than the 7,577 renewal projects awarded in the FY2012 CoC competition. Some of this decline resulted from an increase in the number of projects that were reallocated in FY2013 for new permanent housing projects. The rest is a result of funding cuts caused by sequestration. In FY2013, HUD awarded 622 new projects compared to 489 new projects in the FY2012 CoC program competition. This includes new permanent housing projects created through reallocation, CoC planning, and where applicable, UFA costs. In 2013, we saw more CoCs than ever before choose to reallocate. 188 CoCs chose to reallocate to permanent supportive housing projects for persons experiencing chronic homelessness, and 105 CoCs chose to allocate to rapid rehousing for families coming from the streets or emergency shelter. 64 CoCs chose to reallocate to both. The next topic I'm going to discuss is CoC need amounts, which will include a discussion of the GIW and how tiers were established. Based on the estimated annual renewal demand for each CoC, HUD anticipated that the national ARD for the CoC competition would exceed the $1.7 billion available under this NOFA. This meant that HUD would be unable to fund all eligible renewal projects. To help communities prioritize their projects, CoCs were required to rank projects in two tiers. Tier 1 was equal to the CoC's annual renewal demand from the final HUD-approved grant inventory worksheet, minus 5%. Tier 2 was the amount remaining in ARD plus the approved amounts for CoC planning and UFA costs, if applicable. Annual renewal demand, or ARD, was calculated for every CoC during the CoC registration process. It was equal to the sum of the annual renewal amounts, or ARA, of all eligible renewal projects expiring between January 1, 2014 and December 31, 2014, before any adjustments were made based on the fair market rents. HUD provided CoCs with a 7-day grace period following the publication of the NOFA to make final adjustments to their GIW, such as adding another eligible renewal project that had previously been forgotten. No changes that would increase the CoC's ARD were recognized after the 7-day grace period. Projects eligible for renewal in FY2013 that were not included on the final HUD-approved GIW were still able to apply for renewal funding, but because the Tier 1 threshold was based on the lower ARD that did not include the project, placing that renewal project into Tier 1 would bump other projects into Tier 2. HUD published the final ARD amount less 5% to notify CoCs of their final HUD-approved amounts. HUD included all one-year FY2012 new project awards on the original GIW that was sent out to field offices and CoCs. However, projects were only eligible to apply for renewal funding if they had a grant agreement executed by December 31, 2013, and an operating start date of no later than January 1, 2014. Due to the late announcement by HUD of the 2012 new project awards, many of those projects did not go to grant agreement by the required deadline. HUD published an FAQ in December 2013 reminding CoCs that the NOFA stated that HUD would remove the annual renewal amount from a CoC's 2013 ARD if it determined that any project listed on the CoC's final 2013 GIW was a new project awarded in the FY 2012 CoC program competition that did not have an executed grant agreement by December 31, 2013. The FAQ went on to say that if HUD were to remove an FY 2012 project because it was not executed by HUD by December 31st, it would lower the CoC's ARD and Tier 1 amount, and the CoC would need to be mindful of that change when ranking projects for the CoC priority listing. HUD did not publish or send out revised ARD amounts based on these changes. In order to ensure an accurate listing of eligible renewal projects, it is imperative that the collaborative applicant effectively communicate with the project applicants and the HUD CPD field office so that the final ARD established by HUD is as accurate as possible. Finally, CoCs were required to rank projects entirely into Tier 1 or Tier 2. This meant that when a CoC did its ranking, the project at the bottom of its Tier 1 list had to fit entirely into Tier 1 or the entire amount was pushed into Tier 2. If a CoC chose to rank a project in Tier 1 that was not included on the final HUD-approved GIW, it meant other projects included on the GIW would be pushed into Tier 2 since the CoC's ARD amount would not be increased. What this meant was that those CoCs who are required to absorb a larger cut if the projects had been included on their GIW. As in FY 2012, HUD used a two-tier process to allow CoCs to prioritize and prepare for potential budget cuts. The tier line was set at a CoC's ARD minus 5%, and CoCs were given the freedom to place projects in the two tiers as they saw fit. HUD encouraged CoCs to strategically assess their projects to prioritize those that were most needed and best performing. CoCs used a variety of approaches. Some CoCs cut across the board to fit everything into Tier 1. Others applied for the full ARA amount for each project and placed one or more projects in Tier 2. Still, other CoCs chose a hybrid approach, cutting some but not all and reallocating the cut amount and ranking that project in Tier 2. The chart shows how HUD calculated the 5% cut to establish Tier 1. For the next few slides, we'll talk about reallocation, what it is, and what options CoCs had for FY 2013. Reallocation is a process whereby a CoC reallocates funds in whole or in part from one or more renewal projects to create one or more new projects. New reallocated projects are like other new projects in that they cannot begin operating or incurring costs until the new grant agreement has been executed. Project applications use funds from renewal projects to apply for new reallocated projects. However, reallocated projects are not guaranteed to be funded. They also cannot be a continuation of a current or existing effort, although the applicant for a new reallocated project can be the same entity as the recipient of the expiring renewal project. Costs incurred by an organization whose renewal project has expired and who has applied for a new reallocated project will not receive reimbursement from HUD for the period of time between the renewal grant expiration and the new grant's operating start date. Where projects have been reallocated in part or in whole, the project applicant should work very closely with their CoCs and their local HUD CPD field offices. They should develop transition plans for participants currently being served by the project. Project applicants may continue to serve existing participants using alternate funding sources, but cannot use reallocated funds to continue those efforts. Reallocated projects are considered to be hold harmless, meaning they fall within the CoC's ARD amount. However, these projects must also meet the NOFA requirements, particularly around eligible participants and activities. Later in today's broadcast, we'll cover some common problems that resulted in HUD rejecting some new reallocated project requests. CoCs may choose to reallocate funds in whole or in part from any component type as they see fit. CoCs should make decisions about which projects should be reallocated based on a strategic analysis that identifies projects that are underperforming or no longer meeting the needs of the homeless population within the CoC. Reallocation should not be used as a method to simply make changes to an existing project, as that can typically be accomplished through a grant agreement amendment. Any project eligible for renewal in FY 2013 could be reallocated. Permanent supportive housing, transitional housing, safe havens, SSO, and HMIS. The CoC NOFA limited the types of new projects that could be created through reallocation to either new permanent supportive housing, dedicated to chronic homelessness or new rapid rehousing for households with children coming from the streets or from an emergency shelter. During HUD's review of the new reallocated projects, we saw many applications that were not qualified. Many new reallocated permanent supportive housing projects proposed to serve persons who either did not have a disability or who were coming from transitional housing. The definition of chronic homelessness requires that to meet this definition, an individual or the head of household must have a qualifying disability and be coming from a place not meant for human habitation, an emergency shelter, a safe haven, or an institution if they resided there for 90 days or less and entered the institution from one of the other 3 eligible locations. They also must have experienced either a year of continuous homelessness or 4 occasions over the last 3 years where they were living in one of these locations. Persons in transitional housing are not chronically homeless, even if they meet all of this criteria prior to entering the transitional housing program. Another common problem that we saw was related to proposed use of funds. The CoC program interim rule requires that rapid rehousing provide tenant-based rental assistance. However, many new reallocated rapid rehousing projects requested project-based rental assistance or leasing funds for a single site location, neither of which would be eligible. HUD tried to the maximum extent possible to award as many projects as we could, but it was clear that some proposed projects would be unable to comply with these requirements. I am now going to turn it over to Diane Smuchler to talk about the CoC application and scoring.
Thank you, Lisa, for addressing the highlights of the fiscal year 2013 competition. As Lisa said, I'm going to talk to you in more detail about the scores on the CoC application, the tools and guidance that CoCs needed to use to successfully complete their CoC application, and I will walk you through the areas where CoCs clearly struggled. CoC applications were assessed on a 150-point scale plus a possible 6 bonus points for a total of 156 points. Those CoC applications that scored the highest had a better chance of receiving Tier 2 fundings than CoC applications that scored lower. The score received for the application will carry forward into the fiscal year 2014 funding process. By now, each CoC should have received their debriefing summary from the local HUD CPD field office, which provides your total score broken down for each section of the CoC application. Any collaborative applicant that has not received their debriefing summary should contact their local HUD CPD field office. As you can see on the slide, the high score this year was 148.25, and the low score was 45. The average score for all CoCs was 113.5 points, with a median of 116.5. This chart shows how all of the CoC application scores were distributed. You'll notice that 41%, or 169 CoCs, were within around 10 points of the average, in the range of 100 to 119 points. Another 40% scored well above average, at least 120 points. Now that you have a sense of the overall CoC application scores, we'll move on to discuss the resources available to complete the CoC application and general guidance for this process. This year, the collaborative applicants had many resources to use to assist them in completing the CoC application. These resources included 24 CFR Part 578, the fiscal year 2013 HUD General Section NOFA, the fiscal year 2013-2014 CoC Program Competition NOFA, the fiscal year 2013-2014 CoC Application Detailed Instructions, the CoC training materials on 1CPD, including the frequently asked questions, Ask a Question or AAQ, and finally, all competition-related 1CPD listserv messages, as these are HUD's primary vehicles for communicating with CoCs and other stakeholders. This year, in an effort to provide as much assistance as possible, HUD provided detailed instructions as part of the eSNAPS application and a training guide via the 1CPD website. The training guide included step-by-step training modules for each section of the application, and the detailed instructions walked collaborative applicants through every question and explained what was expected to be included in each response. You may have observed that the detailed instructions were much more comprehensive than in years past, and they outlined each point that the collaborative applicants were expected to cover. When CoCs lost points, it was frequently because they failed to address each of the key elements listed in the question and in the detailed instructions. For example, the detailed instructions may have stated that the collaborative applicant was to address 3 elements to their response to a question. In order to receive the maximum points for that question, all 3 elements needed to be fully addressed. In addition to these resources that are listed on the slide, applicants also had the ability to ask questions through the Ask a Question or AAQ system on 1CPD. We answered all the questions we were allowed to answer under the HUD Reform Act. Finally, we published several frequently asked questions on the 1CPD webpage. Notifications of updates to the FAQs were shared via listserv messages, so it is vital that all CoCs ensure that they are on the listserv and that they read the messages completely. HUD expected that CoCs utilize all of these resources. The CoC application may change from year to year, so it is important to treat each year's application as a new endeavor and review all of the materials for that year. Now let's discuss the details of this year's CoC application. CoCs were scored on 7 distinct sections, which you can see on the slide, for a total of 150 points. In addition, it was possible to receive up to 6 additional bonus points for a total possible score of 156. Today, I'll discuss each section, spending more time on those areas that were new or where we saw many CoCs losing points. Now, we'll start with Section 1. This is related to CoC strategic planning and performance. CoCs could receive up to 69 points for demonstrating a plan for and progress towards reducing homelessness in their geographic areas, with a focus on chronic homelessness, particularly those who have had the longest experiences of homelessness. The average score for this section was 51.5 points out of 69. The first section of the NOFA corresponds with questions 3A number 1 through 3A5 and sections 3D of the CoC application. So for each of the 5 objectives, collaborative applicants were expected to provide baseline information for 2013 and set reasonable numeric goals for 2014 and 2015. Collaborative applicants also had to provide narrative responses for each goal to demonstrate how they would reach it and who would be responsible for each action or step. On the slide, you will see the 5 objectives with the average score among all the CoCs for that objective. The objectives are a very important part of the CoC program, so I will walk through each one individually, but you will notice that this year CoCs did fairly well overall with the housing stability, jobs and income growth, and mainstream benefits objectives. I'll spend a little more time discussing the ending chronic homelessness and rapid rehousing objectives, since with averages of 65% and 74% respectively, these are areas where CoCs clearly struggled. Objective 1 was related to ending chronic homelessness. This is a top policy priority for HUD and the first goal in opening doors, the federal strategic plan to prevent and end homelessness. Slow progress in meeting this goal has resulted in the administration extending this goal by 1 year to 2016. In order for this to happen, CoCs need to use existing resources in a manner that prioritizes this population and ensures that there are sufficient resources to address this need. For a CoC to receive maximum points in this section, it needed to demonstrate that it will increase the number of available permanent supportive housing beds dedicated to chronic homelessness, and that it would prioritize people experiencing chronic homelessness in at least 85% of its non-dedicated permanent supportive housing turnover beds. The majority of CoCs have not met the goal of 85%. On average, only 47% of CoC's non-dedicated permanent supportive housing turnover beds became prioritized for chronic homelessness in 2013. The good news is that the majority of CoCs projected to meet or exceed this goal of 85% by 2015. Collaborative applicants were required to attach a list of projects that would meet the prioritization goal, but most CoCs lost points since less than half of all CoCs included an attachment. It should also be noted that while many CoCs did not commit to prioritize chronic homelessness in 85% of their non-dedicated PSH turnover beds, almost all CoCs did indicate that they will prioritize chronic homelessness in some way, which is progress, even if those CoCs did not get the maximum number of points. Now let's look at Objective 2, housing stability, which is the ability for homeless persons to obtain and maintain permanent housing, including permanent supportive housing. Most collaborative applicants did well on this objective. The majority of CoCs demonstrated that they met the goal of 80% in 2013, with an overall average among all CoCs of 85%. Even with this high percentage, by 2015, CoCs are still projecting to improve to an overall average of 87% achieving housing stability. Objective 3 was related to increasing participant income through employment and non-employment sources. The guidance for this objective was not so clear, so HUD did not score CoCs on the extent to which they met or exceeded the numeric target identified in the NOFA. Instead, CoCs were scored by their action steps to increase the percentage of participants who are increasing income through both employment and non-employment sources. When CoCs lost points in this section, it was often because they did not distinguish between income growth through employment and income growth through non-employment sources. The fourth objective was to increase the number of participants obtaining mainstream benefits. The majority of CoCs demonstrated that they did meet the goal of 56%, with an average overall of 64% of participants obtaining mainstream benefits in 2013. Again, CoCs are still committing to improvement, with a projected increase of the overall average to 70% in 2015. The last objective, rapid rehousing, was brand new in fiscal year 2013. HUD asked CoCs to explain how they would increase the number of homeless households with children that would receive rapid rehousing assistance that was funded from any source. Many CoCs do not currently have any rapid rehousing programs, and also indicated that they do not plan to create them, and as a result, they lost points. CoCs also had to provide information related to the written standards they have in place for those rapid rehousing projects that do exist, and many of the CoCs that indicated that they have rapid rehousing projects did not demonstrate in the CoC application that they have written policies and procedures in place. Now, moving past the objectives and still in Section 1 of the NOFA, this also included questions about the extent to which the CoCs were incorporating the goals of opening doors into local plans, the extent to which they were removing barriers, efforts to end family, youth, and veteran homelessness, and how the CoC is addressing the needs of domestic violence victims, and finally, outreach to unsheltered homeless persons. CoCs struggled with each question in this section. First, CoCs had to address how the goals of opening doors are being incorporated into local plans to prevent and end homelessness. To be fully responsive, the collaborative applicant had to describe how each of the 4 goals of opening doors were being incorporated in the CoC, the progress made to date, and whether or not the CoC was on target to meet each goal. Very few CoCs answered all the parts of this question, and as a result, only 62 CoCs received full credit for this question. Collaborative applicants also had to describe what steps the CoC is taking to assess and remove barriers to entry in projects funded through the CoC program and the Emergency Solution Grants Program, or ESG. Collaborative applicants needed to describe specific barriers that currently exist, the manner in which barriers were assessed, and the specific steps the CoC will take to reduce those barriers. It was not sufficient to simply say that there are no barriers without explaining how the CoC could make that determination. In addition, throughout the CoC application, it was important to pay attention to any question that asked about ESG. All too often, CoCs lost points in various questions because they neglected to describe the connection with the ESG program. CoCs also needed to be specific in describing their outreach plan to end homelessness among households with dependent children, particularly those in unsheltered situations. Many collaborative applicants only generally discussed what they are doing to address family homelessness, but did not specifically mention the CoC's outreach plan, which resulted in lost points. Collaborative applicants were also expected to specifically describe how the CoC is addressing the needs of domestic violence survivors. Collaborative applicants were expected to provide information on the existing projects that serve this population, which most did, but they also needed to describe what policies are in place within the CoC to ensure safety and privacy. Now, collaborative applicants also had to provide a narrative response describing the CoC's effort to identify and engage unsheltered homeless persons. Most CoCs talk generally about how they conduct outreach to persons who are unsheltered, but did not go into detail about the specific outreach plan to reach this population. In addition, CoCs may have lost points because they did not discuss the extent to which the outreach plan covers the entire CoC geographic area, or did not address how they overcome barriers related to geography. Finally, the majority of CoCs did well with their questions related to their efforts to end youth homelessness. But with the question related to efforts to end veterans' homelessness, many CoC applicants lost points. In this case, many CoCs did not demonstrate how they coordinate with the local VA and VA-funded programs to provide housing and services to veterans, or they did not explain how available CoC program or ESG funding is used to serve those veterans who would not otherwise be eligible for VA-funded housing or services, including those veterans who were dishonorably discharged. All right, we've made it through Section 1 of the NOFA related to the CoC application. Go ahead and stand up, stretch, do some jumping jacks, or sharpen your pencil for just a brief moment because we are halfway there. All right, now we're moving on to Section 2 of the NOFA, the section covering CoC coordination of housing and services. CoCs could receive up to 28 points based on the extent to which they demonstrated coordination among their housing and service resources. This section included several new questions, and it is clear that many CoCs struggled with all the questions, new and old. Overall, the average score for Section 2 was 19 out of 28. Now, there's a lot in this section, so I'll cover it step by step. First, preventing homelessness. CoCs were awarded up to 2 points for describing the CoC's effort and strategy to reduce the number of individuals and families who become homeless and the extent in which that strategy has been successful. Many CoCs lost points in this area because they did not include the extent to which they are coordinating with ESG specifically. Discharge planning. In years past, CoCs often struggled with the questions on discharge planning. This year, with more streamlined questions, CoCs did better. Collaborative applicants had to describe the extent to which they ensure that persons being discharged from publicly funded institutions or systems of care are not released into homelessness. Many collaborative applicants improved their overall discharge planning scores by providing clear descriptions of the policies and procedures that were either being developed or already in place. Nonetheless, many collaborative applicants did not clearly specify what the discharging planning steps were and how the CoC specifically was engaged with each institution to provide alternatives to homelessness, and specifically where persons being discharged go upon release from the institutions. Consolidated plan. HUD awarded up to 2 points to CoCs where the consolidated plan for the jurisdictions within the CoC included the CoC's strategic plan goals for addressing and reducing homelessness. The large majority of CoCs did well in this area. Affirmatively furthering fair housing. CoCs were also scored on the extent to which they could demonstrate that they affirmatively further fair housing by marketing housing to persons who are least likely to access housing absent special outreach. To receive full credit, responses to this question needed to address marketing and also describe how the CoC determined which populations were underserved. Now we go on to ESG coordination. Here, collaborative applicants were scored on the extent to which CoCs consult with ESG jurisdictions or jurisdictions to determine allocation of ESG funding. Many CoCs lost points in this area. To receive maximum points, the response needed to specifically address both the 2012 and 2013 allocations. Collaborative applicants also had to provide a description of how performance of ESG-funded projects is evaluated. Coordination with other funding sources. This year, as in years past, we asked collaborative applicants to provide information about the extent to which they coordinate with other programs. However, the list of programs that needed to be included was new this year. To receive maximum points, the collaborative applicant had to describe how it participates in and coordinates with other funding and service opportunities, including housing opportunities for persons with AIDS, temporary assistance for needy families, or TANF, runaway and homeless youth, Head Start programs, philanthropic organizations and foundations, and other housing and service programs funded through federal, state, or local government. The collaborative applicant had to specifically mention each of these programs, even if it was to say that there were no funds within the CoC through that source. Many CoCs lost points because they did not address all the sources of funding listed in the instructions. Now, coordination with public housing authorities. This question was brand new in fiscal year 2013. HUD asked collaborative applicants to describe the extent to which CoCs were collaborating with one or more PHAs within their geographic areas. Overall, the vast majority of CoCs received full points for this question. CoCs lost points if they did not specify an actual PHA with which they are coordinating. The response did not have to mention every PHA within the CoC, just those with whom the CoC is coordinating or attempting to coordinate. Coordinated assessment. Collaborative applicants also had to describe the extent to which they are implementing or are currently operating a coordinated assessment system. Maximum points were awarded to CoCs where it was clear that the system was already in place, and the collaborative applicant described how it is used throughout the entire geography of the CoC. As a reminder, 24 CFR Part 578 requires that each CoC have a centralized or coordinated assessment system, and any CoC that does not have this is out of compliance with the CoC program, which could result in a loss of funding. Next part of Section 2 is adopting a housing first model. Also new in fiscal year 2013, CoCs had to address the extent to which their permanent supportive housing projects have adopted a housing first approach. Maximum points were awarded to CoCs where permanent supportive housing projects were already following a housing first approach. To receive full credit, at least 75% of PSH applicants in a CoC needed to select yes to that question in the project applications. This year, 75% of PSH applications included that they use a housing first model. That means that as a whole, we met the goal. Recipients of these projects will be held to that standard for both 2013 and 2014 grants, since this was a scored element. Next, educational assurances. CoCs were also scored on having policies in place requiring homeless service providers to ensure that all children are enrolled in an educational program and connected to services within the community. In another question, collaborative applicants had to describe how the CoC collaborates with local education authorities to identify homeless households and make sure that they are informed of eligibility for educational services available to homeless children. Many collaborative applicants provided the same response for both of these without regard for the distinctions between them, and consequently did not receive full credit. Preventing involuntary separation. New this year, CoCs were scored on the extent to which they prohibit practices in emergency shelters and housing programs funded under ESG and CoC that deny admission to families with children under 18 based on the age of the children, or that separate families, frequently a male son between the ages of 15 and 18, within their housing. To receive full points, collaborative applicants needed to acknowledge that the CoCs have a written policy in place, or where policies do not currently exist, collaborative applicants had to describe the steps they would take to develop and implement a written policy. The Affordable Care Act. Also new in 2013, collaborative applicants had to discuss how the CoC and homeless assistance providers within the CoC's geographic area are helping participants take advantage of the Affordable Care Act. Overall, most CoCs reported some activities to increase access to health insurance, most commonly by using in-person assisters that are trained to help individuals enroll in ACA-related programs. Accessing other funding resources for supportive services. The last question in this section was related to how CoCs are working to maximize the extent to which non-CoC program funding is used to pay for supportive services. While the CoC program can pay for certain supportive service costs, it is more efficient for CoCs to use other funding sources whenever possible so that HUD funds can be used for housing costs. Now moving on to Section 3 of the NOFA, HUD awarded up to 15 points to CoCs that demonstrate how they ensure that CoC program-funded projects meet the performance measures outlined by HUD. This NOFA section is tied to Section 4A of the CoC application, and with an average score of 9.55 out of 15, it is clear that there is room for improvement in all of the following areas. CoC monitoring of HUD performance goals. Collaborative applicants had to describe the manner in which the CoC monitors the performance of CoC-funded recipients. To get full credit, the description had to include the type and scope of monitoring as well as the frequency in which the monitoring occurs, and the majority of CoCs received full credit on this area. Increasing recipient performance. The collaborative applicants also had to describe their policies and procedures to improve the CoC's project's recipients' performance. Even when CoCs are generally performing well, they needed to describe the protocol to make improvements when needed. Increasing recipient capacity. Many CoCs were confused by this question and gave responses similar to what was provided for the previous question about assisting recipients in meeting HUD-established performance goals. However, this question was specifically about what CoCs are doing to ensure that recipients are successfully carrying out the requirements of the CoC program. In other words, how does the CoC work with low-performing organizations to improve their capacity to manage and administer their projects in accordance with HUD regulations? For full credit, the collaborative applicants had to describe how the CoC evaluates the capacity of their recipients, what steps it takes to improve capacity when problems are identified, and how it provides feedback to underperforming recipients. Reducing homeless episodes. Next, the collaborative applicant had to describe the average length of time that households remain homeless within the CoC and what the CoC is doing to reduce this time period. To receive maximum points, the response had to describe the specific efforts currently in place to track this measure, identify the tools that are used, such as HMIS, and describe how data from CoC and ESG-funded projects are used. The response also had to indicate the current average length of time that households are homeless, or the CoC lost points. Outreach. This question asked for procedures that are currently being used to identify and engage homeless individuals and families. For full points, the response had to demonstrate how the procedures would allow for meaningful outreach to persons with disabilities and persons with limited English proficiency. Finally, tracking and reducing returns to homelessness. The collaborative applicant had to describe the steps the CoC is taking to reduce returns to homelessness, including describing how the CoC uses HMIS or another system to currently monitor returns to homelessness. Section 4 of the NOFA was about CoC housing, services, and structure. CoCs could receive up to 13 points for demonstrating the existence of a coordinated, inclusive, and outcome-oriented community process, including an organizational structure and decision-making process for developing and implementing a CoC strategy that includes representatives from both the private and public sectors, has a fair and impartial project review and selection process, and has created, maintained, and built upon a community-wide inventory of housing for people experiencing homelessness. That is a lot for a CoC to cover. And with an average score across CoCs of 10.74 out of 13, we can conclude that most CoCs are doing well in this area overall. Nonetheless, there are a few areas in this section where many CoCs struggled, specifically in questions about the ranking and selection process and those covering inclusive structure. This year, CoCs had to describe their ranking and selection process and provide documentation via an attachment of how they shared that process with the CoC and with the broader public. CoCs lost points when they did not include the attachment or when the attachment did not fulfill all of the requirements set forth in the detailed instructions, regardless of the quality of the narrative response. For example, the attachment may have included the CoC's ranking and selection process, but it didn't provide evidence, like a printout of the website showing the date and posting, or a dated printout of an email to the CoC showing that the relevant minutes were shared to show that they met this part of the question. Another common mistake was when collaborative applicants reported that the CoC only notified the project applicants of the ranking and review process, which fails to meet the NOFA standard of making the process available to the CoC's full membership. Involving the CoC is at the heart of the Section 4 of the NOFA, and another area where CoCs struggled a bit was in the responses related to having an inclusive structure. CoCs had to specifically explain the extent to which they consider the full range of opinions from individuals or entities with knowledge of homelessness in their geographic area, and many CoCs only responded with a general answer. In addition, CoCs needed to describe the extent to which they are open to proposals from entities that have not previously received funds in prior homeless assistance grants competitions. Many CoCs lost points for only being open to proposals from recipients currently involved in the CoC or not explaining how they ensure that the process for considering new proposals is open to all. Next, we move on to Section 5 of the NOFA, which measured leveraging, as reported in the CoC's project applications. This year, with an average score for leveraging of 1.77 out of 5, it is clear that the vast majority of CoCs, 239 to be exact, failed to meet the criteria for demonstrating a high percentage of CoC funds being supplemented with resources from other public and private sources. Still, 116 CoCs received full points for showing that they had 100% participation in leveraging from all project applications and had a leverage ratio of at least 150%. During the open competition, HUD received many questions related to what qualified as leveraging and clarified that match and leveraging are separate and distinct, and that any amount listed as match cannot also be identified as leveraging. HUD also clarified that leveraging includes cash or in-kind contributions and does not include program income, such as rent collected from program participants. Leveraging additional funds and resources for CoC programs is not only a requirement, but vital and for being able to run a robust and effective program. Where Section 5 was the weakest section, Section 6 of the NOFA proved to be one of the strongest sections. This section focused on the extent to which collaborative applicants could demonstrate the existence of a functioning HMIS that covers the CoC's geographic area and facilitates the collection of information on homeless people's use of residential and other homeless services. This section was worth a total of 11 points, and the average score for this section was 9.29. Some areas where CoCs lost points on Section 6 included when collaborative applicants stated that there was an HMIS governance agreement in place, but failed to include a copy as an attachment. In addition, CoCs that indicated bed coverage rates of less than 86% for any housing type lost points, as did those that indicated a bed coverage rate of less than 64% for any housing type, and then did not provide clear steps on how they intend to increase that percentage for each housing type with a rate below 64% over the next 12 months. In many cases, the explanation provided only discussed why the bed coverage rate was below 64% without providing a plan, which reduced the score. Finally, in this section, some CoCs lost points for failing to attach documentation and cite the correct page number that clearly demonstrated the existence of HMIS policies and procedures that ensure valid HMIS entry and exit dates. Now, as a reminder, per the Violence Against Women Act, or VAWA, Victim service providers are prohibited from entering data into HMIS. There is no impact on the CoC's HMIS score as a result. CoCs should not require domestic violence projects to enter data into HMIS or imply that their projects are less competitive as a result of not being able to enter data into HMIS. VAWA, however, does not prevent domestic violence projects from maintaining a comparable database without personally identifying information and providing the CoC aggregate data to include in the CoC's reporting. Section 7 of the NOFA covered the point-in-time count. Overall, CoCs did quite well in this section with an average score of 7.9 out of 9 points. HUD requires that each CoC conduct a point-in-time count of sheltered persons annually and one of unsheltered persons at least every 2 years during the last 10 days of January. Both the sheltered and unsheltered counts were required in January 2013. Even though the unsheltered count is only required every other year, HUD still strongly encourages CoCs to conduct an annual unsheltered point-in-time count if resources allow, as this significantly increases the quality of the data that a CoC can produce. The area where most CoCs lost points in this section was where the data entered into the CoC application did not exactly match the data entered into HDX. For example, if a collaborative applicant indicated that the CoC's total unsheltered count for 2013 was 147, but the final approved data in the HDX indicated 150, the CoC lost points. This year, HUD provided a supplemental document that showed the PIT count information that we have in HDX for both the sheltered and unsheltered counts on 2 separate worksheets in the document. Still, many CoCs provided data that matched their sheltered counts but not their unsheltered counts, and vice versa, which cost them points. In addition, for both the sheltered and unsheltered counts to receive maximum credit, CoCs had to specifically explain any factors that may have caused the observed decrease, increase, or no change in the numbers. If the PIT count changes by as small as an amount as 1 single person, then the CoC must attempt to explain the reason for the change in the narrative. In addition, the CoC observes no change if the CoC observes no change in their PIT counts from 1 year to the next. To receive credit, they still must explain why there was no change. Finally, CoCs could not receive the maximum number of points for this section if they had experienced an increase in either sheltered or unsheltered homeless persons between 2012 and 2013. And now we arrive at the final NOFA scoring section for the CoC application, the bonus points. These are the extra 6 points that CoCs were able to receive above the 150-point scales. Here, the average score was 3.75 out of 6 possible points. CoCs could earn a possible 2 points if 100% of the project applications requested 7% or less in project administration costs. If any project within the CoC requested more than 7% in administrative costs, even the additional administrative percentage was carved out of other BLIs, for example, supportive services or operating, the bonus points were not awarded as moving funds from other BLIs to administrative costs results in less funding being spent for housing or services for homeless persons. Because this score also applies to fiscal year 2014, where CoCs earn the bonus points, the 7% limit on project administration costs will also apply to fiscal year 2014 awards. CoCs could earn 2 points if the CoCs did not rank any SSO projects, excluding those that were awarded in the fiscal year 2012 CoC program competition for coordinated assessment, in Tier 1. Finally, CoCs could have earned 2 points if they had accurately and completely included all the submitted project applications on Form HUD 2991, also referred to as the Consolidated Plan Certification Form, with their original CoC application. If HUD had to conduct a callback due to missing, incorrect, or outdated information on the HUD 2991 form, the bonus points were not awarded. It is HUD's expectation that the HUD 2991 accurately records all submitted project applications and is signed by the proper authorizing official or officials. Now we have arrived at the end of the CoC application review, and I would like to hand the presentation over to my colleague, Matthew Aronson, who will discuss the fiscal year 2013 project application.
Thank you, Diane, for that wonderfully comprehensive review of the project application. Before we begin discussing the project application, it is important to note that HUD expects project applicants and the collaborative applicant to work closely together during each competition. CoC decisions, including information on the final grant inventory worksheet, or GIW, and the reallocation forms, must be discussed so that applicants can apply accordingly. Collaborative applicants must then closely review each project application that is submitted. During its review of fiscal year 2013 project applications, HUD saw many instances where both new and renewal project applications contained information that resulted in a condition, or in some cases a rejection. When collaborative applicants review each project application that is submitted in eSNAPs in its entirety and communicate expectations effectively with project applicants, we believe that they can avoid costly mistakes and possible rejection. The following slides are designed to give you a better understanding of the project application and to help you resolve issues and conditions from fiscal year 2013, apply more accurately for fiscal year 2014, and to preemptively answer project application questions that you may have over the next few months. The application is updated on an annual basis to account for minor changes to competition rules and procedures. For example, in last year's project application, there were specific fields for new project applications designed to address the NOFA requirement that only permanent housing projects were eligible, and only to serve certain populations. The application also adopted new fields to indicate a special population focus and to better account for dedicated chronic homelessness beds. The key to a successful application is understanding these changes and the basic rules, procedures, and application requirements contained in the CoC competition resources. Before you begin an application, you must review these resources and have a good understanding of your own project. For renewal projects, that means knowing exactly what is on the CoC's HUD-approved GIW. As previously mentioned, for both new and renewal projects, it is vital that there is clear and consistent communication between the CoC and project applicant so that both entities have exactly the same expectations for the competition. The CoC must review every project and know exactly how applicants are applying, and applicants must know exactly how the CoC has included on the GIW and will include on the reallocation forms and the project priority listings. There are several standard HUD attachments that are required to be attached to the project application profile in eSNAPs. There are links to upload the HUD 2880, Code of Conduct, Drug-Free Workplace, and if applicable, the SFLLL, Disclosure of Lobbying, and Documentation of Nonprofit Status. Of particular note is the HUD 2880, which needed to be dated no earlier than September 1, 2013 for last year's competition, and which needed updating and accurate program names and project amounts. Many project applicants resubmitted older versions of the form or did not properly complete the form, which led to conditions on projects and delays in funding. All forms should be up to date, and applicants must review them to ensure they are completed correctly. Some errors were errors concerning nonprofit documentation. This may jeopardize a project's eligibility for funding entirely. The only allowable new projects in FY 2013 were new reallocated projects and requests for CoC planning or UFA costs for the 2 UFAs. As stated earlier in this broadcast, the CoC competition limited reallocation to new permanent supportive housing for people experiencing chronic homelessness and new rapid rehousing for households with children coming from the streets or emergency shelter. Although the funds associated with new reallocated projects are considered to be hold harmless and are included in the CoC's annual renewal demand amount, the new project requests must meet all NOFA threshold and eligibility requirements and meet the requirements of the CoC program interim rule. it was clear during HUD's review that many CoCs and project applicants were simply changing the component type of an existing project without ensuring that the project met the criteria of that new component. As Lisa talked about earlier, new reallocated projects were intended to be new efforts and not a continuation of existing activities with current participants under a new component type. HUD carefully reviewed each project application to determine if it met threshold requirements and tried to preserve these funds for the CoC as much as possible. However, in some cases, the information provided was so problematic that HUD did not have a choice but to reject the project. Participant eligibility was a significant problem with many applications that were rejected. Some projects indicated that more than 50% of proposed project participants were not eligible for the type of project being proposed. For new reallocated permanent supportive housing, 100% of participants served must meet the definition of chronically homeless as defined by the CoC program interim rule. For new reallocated rapid rehousing projects, 100% had to be from families coming from the streets or shelters. Persons coming from transitional housing are not eligible for either of these projects because they're not chronically homeless, as required for new permanent supportive housing, and they are not coming from the streets or emergency shelters, as required for rapid rehousing. Yet HUD saw many new reallocated projects that stated that they plan to continue serving existing transitional housing program participants. Additionally, for rapid rehousing projects, project-based rental assistance and leasing are not eligible activities. Many new reallocated rapid rehousing projects propose to provide rapid rehousing in a single property, which is not allowed under the CoC program and is not consistent with the rapid rehousing model. In still other cases, applicants were identified as having serious capacity issues by the local HUD field office. Finally, some projects were reduced or rejected because of an inconsistency with the CoC's reallocation forms. Projects were rejected if the project budget was either not included on the CoC's reallocation forms or if renewal funds that were reduced to create a budget for the reallocated project were deemed ineligible or inadequate to fund the new project. If the amount that was eligible to be reallocated was less than the project budget for the new reallocated project, HUD reduced the project budget. The most important requirement for renewal projects is that they are submitted by the current grant recipient as awarded or amended. The application must not be completed by a project subrecipient or the collaborative applicant if the collaborative applicant is not the grant recipient. This year, several renewal project applications were submitted for HUD review that were completed and submitted by the subrecipient, with subrecipient contact information rather than the current recipient's information. This makes it very difficult for HUD to make an award and has led to project rejections. Renewal project applications are considered to have already met the project quality threshold requirements in the NOFA, which means that there should be no project changes or amendments initiated through the application process. Renewal project applications are, however, required to meet project eligibility, capacity, timeliness of expenditure, and performance standards identified in the CoC program NOFA, the NOFA under which they were originally awarded. They must meet all requirements of the CoC program interim rule. During HUD's review of renewal project applications, we discovered that many renewal projects had significantly changed program information, were potentially serving ineligible populations, or were requesting ineligible expenses. For example, project or permanent supportive housing projects dedicated to chronically homeless persons were serving persons coming from transitional housing. Some renewal project applicants attempted to change their component type, and others moved significant amount of funds from one budget line item to another. Special initiative projects, such as those awarded as Samaritan or permanent housing bonus projects, were required to continue to operate according to the rules under which they were awarded. Unfortunately, many former special initiative projects failed to meet the eligible participants or budget line item rules outlined in the relevant past competition NOFAs. Next, I want to talk about a few items that apply to both new and renewal projects that are important for applicants to keep in mind. First, the project application this year asked project applicants if they followed a housing first approach. This question applied to new and renewal permanent supportive housing projects, and each of the projects that selected yes received a grant condition reminding them that they're required to follow this model. The CoC score was impacted by the extent to which its PSH projects selected yes to this question, and because the score applies to both fiscal year 2013 and fiscal year 2014, this condition will apply to both years. As a reminder, under a housing first model, housing must be offered without preconditions or requirements for service participation as a condition of occupancy. The application also included 2 questions regarding educational assurances required under the Hearth Act. These questions are applicable to all projects serving persons under 18 years of age and may be applicable to projects serving youth up to ages 24. If public education in your community is guaranteed in any way until age 24, then your program must comply with these 2 educational assurances to ensure that each of your participants receives the same public education services that all persons in the community have access to. If a project answered no or NA, not applicable, to these questions, and listed persons under 18 or between 18 and 24, the project was most likely conditioned, and the issue must be resolved with the local HUD office before grant agreement. Finally, it is important to understand that the application is a review of a complete and connected document, and so it is vital that information from one part of the application matches information from another part of the application. For example, information provided in the narrative project description must match information provided from the supportive services screen, the housing type and location screen, the HMIS screen, the population charts, the performance measures, and the budgets. While there are reasons why some information on these screens will be marginally different, many projects included information that was wildly incompatible. In many of these cases, projects were conditioned and recipients will have to resolve these inconsistencies with the local HUD office before a grant agreement. In a few rare examples of egregious inconsistencies, renewal projects were rejected. Finally, I want to leave you with a few things to remember about the project application. For renewal projects, the application is not a place for surprises. The renewal request must match the CoC's HUD-approved GIW, and the only acceptable changes are those that reflect simple budget reductions to match CoC-level reallocation or tiering decisions. New project requests must match the reallocation forms. Reallocation is intentionally a community-led decision, and so HUD reviews new projects in tandem with the reallocation forms submitted by the CoC. If the information doesn't match, it can adversely affect the new project award and possibly lead to a rejection. All of the rules and requirements are captured in the publicly available competition resources. Please make sure to review all notices and documents made available by HUD, including listserv notices and frequently asked questions. And when in doubt, go back to the rule in the NOFA. And finally, there is no better safeguard against unexpected outcomes than good communication with your CoC. Communicate, communicate, communicate. And when in doubt, submit a question to the Ask a Question AAQ. I am now going to turn things back over to Lisa Hill to take us beyond fiscal year 2013 and talk a little bit about the fiscal year 2014 GIW and CoC registration process.
Thank you, Matt. I will briefly walk you through what to expect for the FY 2014 GIW and CoC registration process. HUD has sent pre-populated GIWs to the CoCs and local HUD CPD field offices. CoCs will need to reconcile their GIW, including removing any FY 2013 new projects that they predict will not be eligible for renewal in the FY 2014, and adding projects awarded in prior competitions that are eligible for renewal for the first time in FY 2014. CoCs should do their best to determine the feasibility of whether or not a new project awarded in FY 2013 will in fact be ready for renewal in FY 2014. To be considered eligible for renewal in the FY 2014 competition, a project must have an executed grant agreement by December 31st, 2014, and an expiration date between January 1, 2015 and December 31st, 2015. Once the CoC has reconciled the GIW with its project applicants, it will send it to the local HUD CPD field office for their review. After the field office review, the SNAP's desk officer will conduct their review and then send the CoC their final HUD-approved GIW. The CoC will only receive one final GIW from HUD. As in previous years, the CoC will have 7 days to make any changes to the final HUD-approved GIW after the FY 2014 funding notice is published. The notice will include the dates for the 7-day period. Because HUD anticipates making announcements prior to the end of this calendar year, if HUD determines after award that a project did not go to grant agreement as predicted, the renewal award will be withdrawn and the project applicant will be eligible to apply for renewal in the following year. The majority of the columns and the functionalities of the FY 2014 GIW are very similar to the FY 2013 GIW. However, the GIW has been streamlined in FY 2014, so the CoC and project applicants must pay close attention during the GIW reconciliation phase. As you can see on the slide, the ARD has been moved to subsection 2, which makes it easier to view when initially opening up your GIW. The effective date and the operating start date columns have been removed. There will be no capacity reviews on the GIW. That section is now a general comment section. For the FY 2014 competition, there will not be a separate CoC application. However, CoCs are still required to register in eSNAPs. The final GIW will need to be attached to the priority listing during the FY 2014 project application phase. No changes to geography will be permitted during the FY 2014 registration. This means that CoCs must register in the same way that they registered in FY 2013. Collaborative applicants will not be required to upload the GIW on behalf of the CoC. However, collaborative applicants will still need to enter the total CoC annual renewal demand. UFA questions have been revised slightly. Collaborative applicants designated as UFAs in FY 2013 must reapply if they wish to be UFAs in FY 2014. As stated earlier, it is critical that CoCs know their inventory of projects to ensure that the final calculated ARD is as accurate as possible. After the 7-day grace period, HUD will not increase the ARD if projects are inadvertently left off. However, HUD will decrease the ARD automatically if projects that had not been included are later determined to be ineligible and the problem is identified prior to grant award. CoCs will not be notified of these changes. Therefore, communication between CoCs, project applicants, and field offices is critical. The following resources will assist you in reconciling the GIW and completing the FY 2014 CoC registration. CoC GIW instructions. CoCs received detailed GIW instructions with their GIW. These instructions contained important policy information that could impact how projects on the GIW are reviewed. The AAQ Ask a Question and CoC registration training modules, both located on the OneCPD website. FY 2013 project application. The pre-populated items in the GIW reflect what is in eSNAPs and what was awarded for the FY 2013 competition. CoCs can review their FY 2013 project applications and current grant agreements to ensure project characteristics are correctly reflected on the GIW. We will post today's webcast on the OneCPD website and on HUD's website. It is imperative that if you have not already done so, please go to OneCPD and sign up for one or more of the listservs. This is our primary way of communicating with our CoCs and grantees. This concludes the SNAP CoC Program Competition Debriefing broadcast. Thank you for joining.